A life has started to form, yet the life within the womb of Mrs. Rachel would not be one she had expected. After making her way to a doctor for a screening of her baby, she found out that the embryo inside of her had been diagnosed with a very rare condition, trisomy 13. A lot of questions raced through her mind. What is it? Is it treatable? How dangerous is it? And how did this even happen? Yet the doctor calms her down. He will explain just what this condition is, and perhaps we will learn something from it too. Trisomy 13, which is also known as Patau syndrome, named after Dr. Klaus Patau, who first researched it, is a genetic disorder that is caused by the presence of an extra copy of chromosome 13 in some or all body cells. This leads to severe developmental and physical abnormalities. It occurs in about 1 in 10,000 to 20,000 live births. However, many children die in the womb before they have reached a viable age, resulting in a miscarriage or stillbirth. Therefore, the number of cases of trisomy 13 is probably much higher. Yet, as the doctor informs, there are certain risk factors that can also cause trisomy 13. For example, the maternal age of women being over 35 years old, or a genetical predisposition. There is no current cure or even treatment for the disease, and is 100% fatal. However, there have been recent studies to see if there are treatments that can improve the quality of life of the babies, yet such treatments have not been discovered quite yet. Yet how does this condition even come to be? It all starts on the cellular level, in a process called meiosis, the creation of our sex cells, also known as gametes. Normally, human cells contain 46 chromosomes arranged in 23 pairs, with one chromosome from each pair inherited from each parent. These pairs are called homologous chromosomes. In trisomy 13, a person has 3 copies of chromosome 13 instead of the usual 2. This occurs due to a random error in cell division, specifically during meiosis 1 or 2, where either a homologous pair of chromosome 13 or a 2-chromatid chromosome 13 fails to separate properly, resulting in a gamete, egg, or sperm with an extra chromosome. Let's take a closer look at it. Each cell has 46 chromosomes, as you know. In meiosis, these divide into 23 chromosome gametes to combine with the gamete of the other sex during fertilization. To demonstrate, let us focus on one pair of chromosomes, the affected chromosome 13 pair. When meiosis starts, the chromosomes are present as homologous 2-chromatid chromosomes, with each consisting of 2 sister chromatids connected by the centromere. Despite technically being 2 identical chromatids, they are still counted as one chromosome until they are separated during meiosis. Usually, this homologous pair splits apart during meiosis 1, each of the 2-chromatid chromosomes entering a separate cell along with all the other chromosomes, forming 2 23-chromosome cells. Then, the sister chromatids get pulled apart in meiosis 2, forming 4 23-chromosome cells. Yet, in a process called non-disjunction, chromosomes fail to split apart, resulting in one too many, chromosome 13. This can happen either meiosis 1 or meiosis 2. In meiosis 1, the homologous chromosome 13 pair fails to separate, resulting in one cell having both copies of chromosome 13, amounting to 24 chromosomes, while the other cell receives no chromosome 13, leaving it with only 22 chromosomes. These then continue to split, leaving 2 24-chromosome gametes and 2 22-chromosome gametes. In meiosis 2, the first step goes just as planned. However, in the second step, the 2 sister chromatids on one or both of the cells fail to separate, yet again resulting in one too many in one of the cells and one too little in the other. When this gamete with an extra chromosome 13, either from meiosis 1 or 2, combined with the normal gamete during fertilization, the resulting zygote has 47 chromosomes. The extra genetic material disrupts normal cellular processes, leading to developmental abnormalities at the molecular and cellular levels, which impacts growth, organ development, and function. Yet, what exactly are these abnormalities? Let's talk about the symptoms of trisomy 13. Babies with trisomy 13 often have facial differences, like a cleft lip or palate, and small or misshapen eyes, sometimes so severe it affects their vision. Their heads may be smaller than average, and their brains might not develop fully, a condition called holoprosencephaly. Then there are physical challenges, extra fingers or toes, which is called polydactyly, low-set ears, and sometimes issues with the scalp, like missing skin. Internally, the heart and kidneys can have structural problems, making survival tough. And sadly, most babies face severe intellectual and developmental delays if they do survive past infancy. It's a rare syndrome, and each case is unique, but these symptoms give a picture of how it impacts the body. Now that Mrs. Rachel knows more about her child's condition, she has a more educated mind and can now think about how to proceed with her pregnancy. And for us, we now too have a clearer view of the causes and effects of trisomy 13, one of the many trisomy disorders that can occur during the process of making and developing a baby. Thank you for watching our short explanatory video of Trisomy 13. We hope to see you again soon.